While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Hormones, hormones, hormones. We've all heard about them. Some of us know more than others, but they've become more important over the past few years with stress. So we know cortisol is a stress hormone. So today I brought in a hormone expert, my colleague and friend, Dr. Jerry Bailey. He's a doctor of chiropractic, an acupuncturist, and a bunch of other acronyms after his name that I didn't memorize, but it'll be on the website. Welcome, Dr. Bailey.
Hey, thanks for having me, Tim. Excited to be here. Yeah, a lot of initials after the last name that outspell my name. So that way you know that I don't know anything.
Well, we all know the more letters you have after your last name, the better of a person you are, right?
Right, exactly. It's all about collecting letters. Yeah, yep. Yeah. It's like back as going back to Sesame Street. The more letters we collect and can say, leads to more words, leads to more complex thought, leads to making everything complex and as hard as possible.
Awesome. So let's talk about men's hormones. We hear a lot about testosterone, and I know a lot of men, like, as soon as they have a symptom, let's say fatigue or brain fog, they immediately attribute it to testosterone. But the cascade or symphony, hormones are like a finely orchestrated symphony. Can you kind of expand upon the P.H.A.T acronym for folks?
Yeah. The fat syndrome itself, polyhormonal, so multiple hormones, adrenal, stress response, and testosterone deficiency syndrome. So I see this in men. I've been seeing it more and more. Finally saw this pattern. Often we see, guys, like you said, it's like, oh, it's just testosterone. Let's give them testosterone. Well, they'll give them, testosterone injections or gels, and they're good for about 2.5 weeks, and then they just feel like crap again. And then all of a sudden it's bumping the dose, and testosterone levels go through the roof, and they're just worse off. Their health gets worse at that point. So it becomes this complex, yet simple thing in the body. It's just looking at it and then saying, okay, where things are going wrong and how do we correct this? So we'll see it go through multiple pathways. We'll see insulin issues. We'll see increased body fat, cardiovascular dysfunction within there. Not only how the heart pumps, but cholesterol and atherosclerotic issues there. We'll see that sarcopenia start occurring in men. We'll see the maladaptive stress response or adrenal fatigue, adrenal insufficiency. I like maladaptive stress response myself. The imbalance of the hormones itself, it's not just a testosterone issue. They could have totally normal testosterone levels, but their free testosterone's tanked and they're converting to estrogen. So we want to know how that converts in their system. Then we end up with that neurological dysfunction that occurs with guys too. The memory issues, early onset Alzheimer dementias within there that can occur, brain fog, fatigue. All within there. And then also we see kind of what I call pan-membrane permeability. If we have leaky gut, which often we do, which is a membrane permeability, we'll end up with leaky testes. So we'll get the testosterone changes and spermatogenesis changes within there. We'll see the same dysfunction in the membrane in the brain itself. So once we get leaky gut, it's across the body itself. All those membranes start to become leaky.
Yeah, absolutely. I mean, there's not a system in the body that the gut doesn't affect. And I know I'm preaching to Noah about the flood, but in terms of hormones, I've kind of past 6 to 7 years started approaching it from let's balance blood sugar and cortisol first, and then make sure your thyroid's okay, and then look at your sex hormones. Because I got countless people who go to these clinics where they just put in pellets, and oh, if you want to check your thyroid, oh, that's a separate program. You got to pay $3,000 more, and
Mhm.
that's just not how. I mean, you know this, but that's not how the body works. So let's
Yeah.
talk. You mentioned about hyperconverting of or conversion of testosterone to estrogen. So that's the
Mhm.
aromatase enzyme, and
Yeah.
inflammation upregulates aromatase.
Right.
So now we're back to what are some causes of inflammation, correct?
Yeah, again, within there, that increased inflammation, which is occurring in the adipose tissue itself, so that's where we convert in men the testosterone to estrogen there. So again, looking at that inflammatory response, is it from leaky gut? Is it from, and if that's the case, we have to fix that to decrease inflammation. Where is that generation coming from? And figuring that out is really key. Running some simple testing will tell us, if you have digestive inflammation in the cell walls itself, and then looking, globally in the blood itself, looking at C-reactive protein, homocysteine, some of the other markers within there to go like, what is the inflammation doing and where is it coming from?
Absolutely. And for guys who have, let's say, even low libido, it may not be low testosterone. It can equally be thyroid, correct?
Exactly. Yeah. Not we don't often see low thyroid in men. It's more. It's we still see it in men, but often it's in women. But we're starting to see it a little bit increasing in men. We'll see normal levels of T4 and TSH. The T3 is actually starting to drop significantly in them, which is your
Right.
active hormone in there. So again, looking at again, what is occurring? Is it a pituitary issue in the brain? Could be recognition within the brain itself of circulating hormones. Where is that coming from? Where is it going? And then correcting it. You can't just put in, like you said, looking at just dropping in a pellet, or a single supplement, like boom, dropping in a single supplement there. It's what is going on globally in the body to then figure out how to correct it. Occasionally I've seen it. Sometimes it is just an estrogen conversion issue. So we put a aromatase inhibitor in there. But often it's the conglomerate of things. It's the stress response, getting that balanced. It's because the glucose response. Once we see in cells itself, we have receptors on the cells. Once we see a single receptor for some reason start to downregulate, so we're not seeing glucose receptors occurring as much. We're seeing insulin levels increasing, glucose levels increasing. Once that cell goes, oh, we need to pull this receptor in because we have too much, then that cell starts to dysregulate. The other receptors start to shut down. And so then it gets those signals of like, oh, we're getting too much circulating testosterone. Let's drop that down. We're getting too much circulating of thyroid. Let's start dropping that down in there. So that cellular level now is where we're at in that receptor level to know how things are functioning and where they're going on discourse from.
Yeah, I mean, I know a lot of guys think the higher the testosterone, the better, but it's the Goldilocks effect. So, like you
Mm-hmm.
said, the receptors start to downregulate because your body, even insulin resistance, is your body trying to protect your cells, right?
Yeah. We're in a huge protective state right now. We're inundated with so many toxins in the environment, so many higher fat, higher sugar food sources. So we're inundated with this abundance that we haven't had. We've historically, as a culture, as a society, we've been in a lack of abundance. We've been in starvation modes and famine modes. Now, really, in the last 50 years, we are in this overabundance of foodstuffs, overabundance of stimulation in society from chemical and blue light. I mean, you put across the board. What do you want? It's just overabundance, overstimuli from. So the body's just like, hey, we're done. Let's start shutting this stuff down. Now we're seeing the ramifications of that process.
And are you guys seeing men who are younger and younger coming in with symptoms of low testosterone?
Yeah, in the 20s, early 20s, mid 20s, we're seeing it more and more. Low T and especially conversion to free T within there also. So we're seeing that occur. I'm seeing it, that's where that fat syndrome comes. Usually I'm seeing it 35 to 60, but we're starting to see it creep down in the in the younger generation and a little bit in the older generation too. Often it's, with prostate health too, they're always like, oh gosh, we got to watch testosterone. There isn't much research on that. For testosterone and prostate issues, but it is once you have prostate cancer, it's like boom, off testosterone. Let's put the blockers in there, and it's not healthy for guys. So we
Right.
really, looking at a single marker, which often these fly by night, doc in a box, strip mall hormone centers are just looking at one marker and not
Yeah.
looking at in a holistic pattern, in a holistic way to go, what's really going on and where's that causative at? And we get so many clients coming in that have had, women too, that go in and it's like, oh, here's your estrogen. Here's your, oh, you need testosterone. Let's put testosterone pellets in. No, if you're a lady, don't get testosterone pellets put in. You can't control the dose. You can't control how your body responds to it. And once it's in, it's in. It's in for that 3 to 6 months hanging out there till it dissolves and you don't have any more. Often you'll see, it's kind of funny, we laugh about this, as you'll see these pellet centers jump in and these ladies getting testosterone therapy, and all of a sudden a few months down the road, oh, they're back at the office with facial hair growth. So that doc, that whoever's running that clinic now has the laser facial hair removal going on with it too. So it's like you create the problem versus fixing the problem.
Yeah, I know a nurse who works for a plastic surgeon or with a plastic surgeon. She had the pellets put in and she had a permanent deepening of her voice, or what appears to be permanent deepening of her voice. So you really do have to be careful. With women, are you guys seeing low testosterone earlier and earlier?
A bit, we see it a little bit. It's one of those ones is we're not prescribing a ton of testosterone to women. And if it is, it's very small dosage, milligram-ish, so, but then it's how are they converting? And that's why we run the testing, particularly the Dutch test is what we run for looking for a conversion process to know what their body's doing. And even further on, even in men, same thing. We, giving you just testosterone, guys, it's a piss poor way of doing medicine. How are you converting it? And often, like you said, guys get testosterone, they feel great for about 2 weeks, and it's the higher dose, because you're not looking at how your body breaks things down. Once we know how you're breaking it down, discharging it from the system or not discharging it from the system, then we can better work those effects and use a smaller dose. We want the smallest dose possible to get the largest effect, not the largest dose possible to get the smallest effect.
Minimal effective dose, right? MED.
Yeah. Exactly. Versus just cranking up that dosage and getting worse and worse overall.
I know you do a good bit of epigenetics, as do I, and there are certain polymorphisms, as you know, that can cause or make it more difficult for men to metabolize and excrete estrogen. So do you guys look at, if someone's estrogen levels are elevated off the charts, are you looking at multiple factors that could contribute to that, especially epigenetically?
Yeah. The genetic testing that we run too, there's multiple factors within there, multiple SNPs that we can look at, polymorphisms that can help there. We're looking at estrogen conversion, testosterone creation, detoxification process, both MTHFR and COMT within there, or CBS. We're looking at how it's going to affect the nervous system through there, looking at those varied markers in there to know, like, how are you breaking this down genetically, maybe? And then seeing there, one of the big ones, MTHFR, methylation, that's a huge one everybody looks at. There's a smaller one within there that we run is acetylation. So we look at the acetylation SNPs and go, hey, are you, and often it's kind of funny is the clients are the most difficult clients, not that they're difficult, their systems are difficult. It's not, not you personally, you're not a difficult client, your system's difficult. It's an acetylation issue. However, within acetylation itself, there's only a few articles out there on acetylation and detoxification. So we've had to work with that and go, gosh, what is going on? And figure out, like, using some acetylated forms of nutrients to get into the system to help that detoxification process, and they respond better. And one of the ones we use, molybdenum, is a great one that doesn't get used very often. That's a great helper in detoxification. We have one gentleman right now who was in the military and exposed to some pretty toxic junk. Well, it depleted his molybdenum completely. We tested for it. He has literally zero molybdenum in his body. And he was doing great for years, and he had he lost some weight, and all of a sudden in the weight loss, and it wasn't much, it was like 10 pounds, his body flushed with those toxins again because it was storing in his fat, depleted his molybdenum. He's developed a bunch of neurological symptoms, almost a Parkinsonic tremor, imbalance issue. And we retested, and he's got, again, zero molybdenum, and we got him on that now, doing homeopathic dosages because he does not respond with regular therapeutic dosages. And he's doing much better using the homeopathic forms of it, smaller and small microgram doses versus milligram doses.
Awesome. I know you and Dr. Pam have a midlife mastery course is it out yet?
No, it's not out yet. We're trying to get it finished up with recording. As you know, busy practitioners, we have no time to do a lot of stuff besides see patients. So we're in the process of getting that recorded and laid out completely here. Hopefully in the next month to 2 months. So maybe by the end of summer here, 2023, it should be done.
And so it's going to cover men and women's hormones?
Yeah, it's going to really look at mastering that midlife, which is a lot of us are sitting there. We're we've had a great life so far, and we're going, we don't want to be where our parents are now. And we want to be like way healthier going into the next 50 years of our life, using 50 years that midpoint. I plan on living another 50 years and have a great life. And then I always say, like, sliding into home base with a well-used body that's healthy and just like, I'm out, I'm checking out, I'm done.
Gotcha. Absolutely. So you guys do some pretty unique IV therapy there. I was just there, 2.5, 3 weeks ago.
Yeah.
Let's talk about the EBU treatment. Can you tell people what that stands for and what are the primary indications for it?
Yeah, so EBU itself is a lot easier to say, or EBU 2.0, I think, or 2.0, some people say too, but I like EBU, makes it a little more Halloweenish. I like Halloween. Through there. So EBU is extracorporeal blood ozonation and oxygenation. So what it's doing versus a typical major autohemotherapy using lower dose, a higher gamma, but lower dose overall ozone and UVI therapy, which is at max, we can get about 25,200 micrograms of ozone in there at like a 70 gamma dosage. With the EBU itself, and that's only with about 120 cc's of blood, so about 4 ounces of blood. With EBU, it's almost like a dialysis system. We have blood coming out, going through a dialysis filter. As it floats upwards, it gets pushed upwards with the pump. Ozone is going opposite direction, downward against it. So in that process, we are now exposing over an hour and 10 minutes of therapy treatment there, 2 liters of blood versus 2 ounces, 4 ounces of blood. So we get a lot more exposure. We use a 3 to 4 gamma dosage, which gives us over that time period with that volume of blood about 150,000 micrograms of ozone going through there. So we get a larger amount of ozone, we get less side effects often, and it still goes through the UV light system, then back into the body. So you get that stimulation there of the UV light onto the white blood cells.
Yeah, and can you comment on the methylene blue? A lot of people know about, transcriptions and using that. I would advise not taking 900 milligrams of alpha lipoic acid before doing EBU and methylene blue. And I didn't do that, but I think Jerry did. But we'll save that story for another day. What is methylene blue and why can it be beneficial to patients?
Sure. Methylene blue was originally as a dye, was discovered as a dye in the 1800s, I believe it was. And it was used to dye clothing. And then those of you that had like microbiology, you use it to dye stain cells also to be able to see things in the microscope. That was a weird one. In the microscope itself through there. And so methylene blue potentiates your within the 5 steps of the aerobic chain, or the aerobic portion of the ATP production in the mitochondria. It does step 2, 3, and 4, or 3, 4, 5, excuse me. 1 and 2 is anaerobic, 3, 4, 5 is aerobic. Often we're just using those steps 1 and 2 to produce a small amount of ATP and lose the overall ATP production through those steps 3, 4, and 5 in that respiratory chain. So methylene blue comes in and stimulates that. So it works very similar to NAD without those NAD side effects. For any of you who've had an NAD drip for 4 hours or 5 hours there, a long time, it's an uncomfortable process. Methylene blue, as long as you don't do a large dose of alpha lipoic acid, as Tim has discovered in that process, that you can do methylene blue over 40, but anywhere from a 10 to 40 milligram dose, depending on how we usually start small, work our way up to see how you adjust to it. And you get great benefits. You get energy production, helps with detoxification process. You can combine it with EBU and other oxidation therapies. So like high dose vitamin C, your EBU, your regular IV ozone therapy, your 10 passes, you can combine it with that because it's not an antioxidative therapy. It's an ATP productive therapy. Whereas your EBUs, your ozone, your IV ozones, your high dose vitamin C, you don't, because those are oxidative stressors, you don't put an antioxidant in there because you don't want to combat that therapy there. We love the combination of EBU and methylene blue. It works great for a lot of patients. Some people have reactions on occasion. Often it's something they did, like take a bunch of alpha-lipoic acid beforehand. But for the most part, patients feel really great afterwards. I will say that with methylene blue, expect to have some colorful urine for a few days afterwards. It can be from a bright blue color to green and then fade into yellow as it goes to clear there, but it's often a little bit disconcerting when you take your first urination after the IV and you're like, did I eat a Smurf?
Exactly. Exactly. Yeah, and the beautiful thing about EBU is it's, staying in your system longer than, say, a 10-pass ozone IV, correct?
Yes. Yeah. You might not notice, like with 10-pass or your regular IV ozone therapy, sometimes you get a more Herxheimer type reaction, but it's out of the system pretty rapidly within a few days up to a week afterwards, depending on the dosage. EBU is going to be lasting for a month to 2 months, 3 months in the system, causing that reaction over time and causing that red blood cells to function better. You're going to potentiate your white blood cells, your immune cells within there, and that oxidative response to get that to heal through the system. So you might not notice much at first, but it's over that next 2-3 month process that you're going to start noticing even better changes. And we've seen that with clients is some notice responses right away. Like myself, when I get it done, I just feel clean. Like my arteries feel clean, my blood feels clean, I feel clear brain, I have great workouts through there. Others have been like, I didn't really notice much. I had one client that was a little bummed. He did one treatment, and we don't recommend just one treatment, of course, because it takes time. You need several treatments. Usually 3 is what we recommend over about a 4 to 6 week process. He didn't like, he's like, I didn't notice anything, Jerry. I didn't feel great, didn't feel worse, just didn't notice anything. As we talked, we worked with his family for many, many years, is anytime one of the kids or his wife gets sick, the whole family gets sick, including him. Now he's a pilot and he flies all over the place. So he's exposed to a lot of stuff overall, not just radiation from flying, but also from in the planes and the recycling of the chemicals. Yeah, petrochemicals, everything else. And so as we chatted, he was a little disappointed. And I said, well, what's happened in the last month and a half since you had the treatment? And this was earlier this year. He's like, well, kids got sick, wife got sick, but I didn't get sick. But it didn't work. And I said, whoa, wait a minute. Your history is anybody gets sick in the house, you all get sick, including yourself. And he's like, yeah. I said, well, you didn't get sick this time. He's like, yeah. Like, so was that part of EBU, you think? And he's like, he kind of came on. He's like, you know what? You're right. He's like, because we've done a lot of stuff and it still kind of happened. I wouldn't get as sick, but this time I didn't get sick and everybody else did. So for him, that was the response we were hoping to see, is that regeneration of a system so he wouldn't get sick when the other family members got sick.
Yeah, I've had tons of IVs, multiple, types of vitamin C versus colloidal silver, things like that. And I'll say the 10-pass ozone, you definitely feel more immediately and it causes you to hurt. So people think it's working more. But if your drainage pathways are not open, your phase 1, your phase 2 detoxification pathways aren't open, and you're doing 10-pass ozone, that might not end so well, correct?
Right. Yeah, exactly. And so that's what we have to look at too in doing that, is how healthy your detox pathways are. So we'll often use, because of a Herx reaction with our regular IV ozone therapy, or even on with EBU, is we'll have you do like a GI detox formula that we use, or even using molybdenum works really well to help those with that Herx reaction.
Yeah, and I've noticed, as I returned to South Carolina from Idaho, I continue to feel good. It's a lot more humid here, so I sweat a lot more here. So maybe I'm getting more toxins out. But I don't recommend either. I'm not an EBU expert, but I also wouldn't recommend doing just one treatment. Like, you wouldn't take just one dose of a supplement and then write it off and say it doesn't work. So you got to give it time. You got to prep the body. You got to do the other supportive things around that. What are the main reasons people come to you guys for in your clinic overall, 30,000-foot view?
30,000-foot view, it's either hormone or digestive issues is the main stuff that we see, and they go hand in hand through there. Brain and then energy are kind of the next two in line through there. And the hormones, that's the wide range from thyroid, testosterone, perimenopause, postmenopause, premenopause. when we were younger, because I'm 50 this year, when we were younger, it was more of, we did a lot of pre-pregnancy and pregnancy fertility issues for women and men. As we have aged, that's become less for us. We still see it, but not as much. But it's more of that, midlife stuff that we're starting to see in both men and women. There used to be, we had menopause, and then it was andropause. Like, oh, your testosterone goes on pause there too. Well, it's not that simple. It's looking at why that's occurring there. And often, we try to balance it as best as possible without having to give hormones itself. We want the system functioning optimally as best as possible. So then we can get that, minimal dose effect there in people, and hopefully don't go on testosterone, and then, because then we have to worry about ramifications of testosterone therapies and negative effects of that, cholesterol changes, liver changes within there. But if we're managing everything and making sure the body's functioning optimally, that minimal dose will have very little, if any, negative effects on the body whatsoever. And the same thing with estrogen, progesterone. We're not racehorses where you can just dose them up with the thing to get them going through, and then they're good to go. And then once they're done, they're done. We're looking for longevity. How is that longevity going to occur? How are we going to balance that? We may maybe do some EBU therapies on you. We may need to do some other IV therapies, nutrient therapies. We may look at exosomes and stem cells to help balance things globally within there, whether localized injection, or if we're going to do systemic, we'll do IV with those also, because those work very, very well in helping people create longevity and create the health we want in the long term. Health is a journey. Health is not a destination. It's ever changing, ever evolving. We are seeing now that health and medical information is doubling every 7 months. That's how rapidly it's occurring. So if your doc you're seeing is not doing as much continuing education as possible and keeping up to date, they're behind. They are completely behind. And in medicine in general, they're probably close to 20 years behind. And so, find that functional practitioner who is not just doing the training, but doing continuing education constantly to develop and change what they're doing to help you get longevity, get you that long optimized health. That is really, really key. Between myself and my wife, Dr. Pam, the other provider in our clinic, we each do about 100 hours plus a year in continuing education, because we want to know what's the most current stuff and what's going on so that we can bring it in, and we do it on ourselves. Everything we do, we've done on ourselves in the clinic. Ask your doctor if they've done that.
And I think you can count your hours spent with me, a few weeks ago, certainly as continuing education. I don't know anyone more avant-garde than myself when it comes to medical knowledge. So I'll submit that to the Idaho State Chiropractic Association.
Perfect. And definitely for emergency medicine procedures too. That was,
Oh yeah. I mean, we could put in a few central lines. Yeah. Mindset. Let's talk about mindset. Do you see people's mindset changing once their hormones are balanced, or do you think it's bidirectional, meaning it can go both ways?
Both ways for sure. If they're not feeling good, hormones are out of balance, they're mentally going to feel crappy. And if we just work on the mental aspect from it, we'll have an effect, on the body. I mean, mind-body connection there. They are connected within there. And so we do work on both. We work on the mindset with clients too. And part of our health coaches, one of our health coaches is a mindset coach. And all four of them actually work great with coaches, with the clients, because it's mindset's a huge thing. We can, medicine negates it completely and just like, here's your pill for your ill, versus like, no, that's part of the process. We use a 3-step process and work with people. We use food as medicine, movement as medicine, and mentoring, which is going to be an acronym, mentoring is medicine. Within that mentoring, we look at, mentoring and coaching them. We look at their endocrine hormone system. We look at their NMS, neuromusculoskeletal, their brains, their muscles, their joints, their bones within there. Okay. We look at the T, we look at testing, all the testing that we run to figure out what's going on with them, whether, that's full blood work, whether that is Dutch testing, whether that's organic acids, metabolomics, gut testing. I mean, you name, what are we going to run on this person to figure out? Epigenetic testing within there too. We look at that outside environment. So stuff that's outside their body that's coming in, they're exposed to. We look at their resilience. How can they be, how are they adapting or not adapting to that? And how are they resilient to illness and other things happening to their life? We look at infections. We look at nutrient deficiencies. And then again, we look at the genetics there itself to see what's going on. So food is medicine, movement is medicine, and the mentoring is medicine.
What's something you know today that you wish you would have known 10 to 12 years ago?
Oh, good question.
Besides knowing me.
Right. Besides knowing you, which has been immensely changed in my life completely with that. Yes. Well, I mean, the first time we met in person, it was at the Mindshare Summit.
Yeah.
And then you disappeared because you got food poisoning.
I think you mixed something in my food.
I did. I didn't want you there. I wanted to
Was it
poison
arsenic? I think it was arsenic.
a little salmonella.
There you go.
It could have been E. coli too. I can't remember exactly.
They go well together. They're very
Yeah.
symbiotic.
Very exactly. I wish I knew 10 years ago versus today. Really, I think the two things besides the mentoring, I mean, food is really medicine more so now than ever, and movement is so much more. It's one thing that's lacking in today's society. We're sedentary for many years. Up until the last few years, they were saying sitting is the new smoking, how detrimental it is to the body. And it's true. It's those two things are so essential in really moving forward for health and getting out of where you are and where you're stuck at.
Absolutely. I saw a colleague post a study on LinkedIn, I think last week or 2 weeks ago, showing that walking for 30 to 40 minutes a day creates stronger neuronal networks. Neurons that fire together, wire together. So, I remember going from high school to undergrad at Wake Forest, and it was much harder academically, but I was doing well. And first I was confused, but then I was like, oh, I have a break between classes. I'm able to process and assimilate the information versus just hit me with more and more and more and more and more before you get a break. And I think there's a lot to be said for that. So we're going to put up the links. Marcel's going to post the links to the website. But where can folks find you?
You can find me at a bunch of places. I'm ubiquitous. I'm like CoQ10. I'm everywhere. You can go to my personal website, drjerrybailey.com. You can find me on Instagram, Dr. Jerry Bailey. You can find me those two spots. Facebook, same thing. You can go to Lakeside Holistic Health. That's my clinic, both lakesideholistic.com and Lakeside Holistic on I think it's Lakeside Holistic, Lakeside Health on Instagram, and the Book of Face.
Awesome. Well, thanks so much for being here, Jerry. I appreciate it. And tell your better half we said hi.
I will. Thanks for having me, Tim. It's been a blast. And to the audience, you guys rock. Tim's awesome. Keep enjoying the health updates you're getting from him.